Next step in evaluating brainstem cases is to look at the details of the blood supply to the brainstem, because as we've said all along, there are different vascular territories, different arteries that serve the lateral aspect of various brainstem regions versus the medial aspect. So that's where our story is going. So on this page is a picture of the entire circle of Willis, but we're going to concentrate, at least in this part of the conversation, on just the blood supply to the brainstem. And we know that the blood supply to the brainstem is termed by neurologists as being part of the posterior or vertebrobasilar circulation, where the entire medulla is served by branches of the two vertebral arteries, and the two vertebral arteries converge and join at the pontomedullary junction to form a basilar artery. The basilar artery runs up in the midline of the pons, and then once it reaches the midbrain, the basilar artery bifurcates to form a pair of posterior cerebral arteries. So here are the details. The blood supply to the medulla, the medial medulla, is served by feeder arteries from each vertebral that form an anterior spinal artery. So logically, in a moment, when we deal with a patient that has medial medullary syndrome, it's a vascular insult to one of those anterior spinal arteries. Next, the lateral medulla is served by a very significant, important blood vessel in clinical neurology known as PICA, the posterior inferior cerebellar artery, and you can see in paren its job is to serve the lateral medulla. All right. Once we reach the pons, the medial aspect of the pons is in the vascular territories of a series of paramedian branches. They're supplying medial pons in various parts. The lateral pons is served either by AICA, the anterior inferior cerebellar artery that serves the lateral and caudal pons, particularly in the areas of cranial nerves 7 and 8, whereas the rostral pons is more in the vascular rostral and lateral pons is more in the vascular territory of a superior cerebellar artery or maybe an unnamed circumferential branch. All of the midbrain, medial and lateral, is served by branches that emanate off of a posterior cerebral artery.